Thank you for joining me today. In this video, we are going to learn 20 most important psychiatric medications that you have to memorize first to pass the board. And these 20 psychiatric medications begin with Zoloft. Zoloft is SSRI's medication. The class is selective serotonin reuptake inhibitor, and mechanism of Zoloft is it inhibits serotonin transport that increases serotonin activity in the central nervous system. Zoloft is indicated for major depression disorder, OCD, PTSD, panic disorder, social anxiety disorder, and premenstrual dysphoria disorder. Zoloft starting dose is 25 to 50 milligram once a day, depending on the condition and depending on the patient tolerance. Zoloft major adverse side effects include nausea, vomiting, diarrhea, headache, insomnia, sexual dysfunction. It increases sweat or diaphoresis. It lowers the sodium. It leads to serotonin syndrome. You want to monitor the clinical response to this medication. You want to assist the patient and see how they are doing, if their symptoms are improving and decreasing. You want to also assess the suicidal thoughts. This medication creates a suicidal ideation, particularly early in the treatment. You want to also assess the level of sodium. You want to also assess the sexual side effects. You want to also assess the serotonin syndrome symptoms. Zoloft is contraindicated using concurrently with MOAI inhibitors. That is other antidepressant medication. And there has to be 14 days wash up in between Zoloft and MOA inhibitors. You want to be cautious, and it's contraindicated for patients who had severe sensitivity to Zoloft. You want to also caution with bipolar disorder. You want to assist the patient if they have bipolar disorder before you prescribe Zoloft, because antidepressant medications can worsen mania if the patient with bipolar has the mania or bipolar 1. Important interactions with Zoloft include the MOAI inhibitors, other serotonin medications, the medication that also increase the serotonin in the central nervous system. It's also interacts with anticoagulants or blood thinner medications and antiplatelet medications. This medication is antiplatelet and anticoagulant platelets. They increase the risky when you take with Zoloft. They increase the risk of bleeding. The medication that also increase the serotonin, they increase the risk of serotonin syndrome. So if they interact with, they can increase these two risks. So you want to review the medication before you prescribe this medication or give to the patient. You want to educate the patient about Zoloft. You want to educate that the Zoloft benefit may take several weeks. You want to also educate the patient, do not stop this medication quickly. You want to also educate the patient to report if they feel agitated, if they feel any suicidal ideation, if they have a fever, tremor, diarrhea, muscle rigidity, if they have any sexual side effects. You want to also educate the patient if they have to report the risks. Zoloft is SSRI's medication that has wide, broad psychiatric indications. The second psychiatric medication that you want to memorize is Prozac or Fluoxetine. Fluoxetine, it is SSRI's same class of Zoloft. Fluoxetine, it inhibits serotonin reuptake and it increases the activity of the serotonin in the nervous system. Fluoxetine is indicated for major depression disorder. Fluoxetine is also indicated for OCD disorder, panic disorder, bulimia nervosa disorder, premenstrual dysphoria disorder, and other selective conditions. Fluoxetine usually starting dose is 10 milligram to 20 milligram a day. However, the therapeutic dose is 20 milligram to 60 milligram a day for many conditions. Major adverse effect of Prozac is nausea, insomnia, anxiety. It can increase anxiety. It treats anxiety, but it can also increase the anxiety. Sexual side effect, headache, and serotonin syndrome. You want to monitor the patient if they have any mood changes, suicidal ideation, mood activation, mania, hypermania. You want to also assist and monitor drug to drug interaction. Prozac and Fluoxetine is contraindicated taken concurrently with MOA inhibitors. It's also contraindicated with bipolar disorder, and it requires careful assessment if the patient has bipolar disorder. Significant interaction burden. This medication can interact, as we mentioned before, this medication can interact with anti-platelet medication, anticoagulant medication, and blood thinners. It can also, if you take medication that increases the serotonin in the nervous system, that can increase the burden of the serotonin syndrome. Important interaction is fluoxetine has a strong inhibitors with the enzyme CYP2D6. So the medications that have this enzyme can interact with Zoloft and can increase the risks. Also, interaction with Zoloft is also can interact with MOA inhibitor. It can also interact with other medications that increase the serotonin. It can interact with some psychiatric medications. It can interact with Tamafaxine. You want to educate the patient about this medication may be activating. You want to also educate the patient morning administration may be healthy if insomnia can occur. So take this medication in the morning. Do not stop this medication quickly. You want to educate the patient. Prozac has very long half-life. Prozac is the longest effective half-life among common SSRIs. Prozac takes at least 5 weeks before starting MAOIs. So 5 weeks, there has to be 5 weeks between Zoloft and MAOIs medications. Third medications that you want to memorize is the Escitalopram. Escitalopram or Lexapro, it is SSRI's medication, and the class of the medication is selective serotonin reuptake inhibitor, and mechanism of Lexapro is selective serotonin reuptake inhibitor. Lexapro is indicated for major depression disorder. Lexapro is also indicated for general anxiety disorder. Starting dose for Lexapro is 10 milligram a day. Therapeutic dose for Lexapro is 10 milligram to 20 milligram a day. Major adverse effects of Lexapro include nausea, headache, sexual dysfunction, insomnia, low sodium, and serotonin syndrome. You want to monitor the mood of the patient. You want to monitor if the patient have any suicidal ideation. You want to monitor and assess sexual side effects. You want to monitor the sodium lab. You want to also assess if the patient have any mania or hypermania symptoms. Contraindication of the Lexapro, it is monoamine oxidase inhibitor. MAO inhibitor uses is contraindicated with Lexapro. It's also contraindicated taking or giving or prescribing for bipolar disorder. And it requires screening and assessing the patient before prescribing Lexapro to a bipolar patient. Lexapro can increase the QT, and it can increase the QT prolongation, and it creates QT prolongation. So you want to assess if the patient has any arrhythmia, cardiovascular diseases before you prescribing this medication or before you giving the patient to this medication. Important interaction with Lexapro include MAO inhibitor, other serotonic medications that can also increase the serotonin in the central nervous system. It is also can interact with the other medication that can increase the QT prolongation and that can affect the cardiovascular. You want to educate the patient on this medication. You want to educate the patient to take the medication consistently to see benefit. You want to educate the patient that this medication, Lexapro, takes longer to see the benefit. Therapeutic benefit takes time. You want to also educate the patient to take the medication consistent and do not discontinue this medication quicker. You want to educate the patient to report symptoms of sexual dysfunction, symptoms of suicidal ideation or mood change. You want to educate the patient to report symptoms of serotonin syndrome. Lexapro is simple. Lexapro is well tolerated SSRI medication and commonly used for depression and general anxiety disorder. Next medication you want to memorize, that is the fourth medication, is Venlafaxine. Venlafaxine class medication is serotonin norepinephrine reuptake inhibitor. It's SNRI. Venlafaxine inhibits both serotonin and norepinephrine in the nervous system. It inhibits both serotonin and norepinephrine, and it increases both serotonin and norepinephrine in the central nervous system. So it inhibits serotonin and norepinephrine reuptake. That increases serotonin and norepinephrine activity in the central nervous system. Venlafaxine is indicated for general depression disorder, major depression disorder, general anxiety disorder, social anxiety disorder, panic disorder. starting dose for venlafaxine is 37.5 to 75 milligram per day, depending on the formation. However, the therapeutic dosage of the venlafaxine is approximately 75 to 225 milligram per day for extended relief formation. Major adverse effects of venlafaxine include nausea, diaphoresis, sexual dysfunction. It increases blood pressure. It causes insomnia. It increases the heart rate. It also has discontinuation syndrome. So you want to taper this medication. You want to monitor the blood pressure when the patient is taking this medication. You want to monitor the heart rate. You want to monitor the mood. You want to monitor suicidal ideation. You also want to monitor serotonin syndrome symptoms. Contraindication of the venlafaxine include MAO inhibitor that you need in between them for at least 14 days wash-up period. It's also contraindicated for uncontrolled hypertension that requires caution. If this medication already increased the blood pressure and heart rate, so if the patient has a hypertension, especially uncontrolled hypertension, and if they have a heart issue or high heart rate, that is contraindicated. This medication, which is the venlafaxine, is also contraindicated for the patient who have a bipolar disorder. So you want to screen before you give this medication to patient who has a depression. You want to screen bipolar disorder because this medication can worsen manic episode or hypomania. This medication, which is the venlafaxine, can interact with MAO inhibitor. It can interact with other blood pressure medications. It can interact with serotonin medications that increase the serotonin and that increases the serotonin syndrome symptoms. You want to educate the patient never stop this medication, never stop venlafaxine quickly. It has to be taper. Withdrawal symptoms include, if you stop this medication, you may experience withdrawal symptoms, and these symptoms include dizzy, irritability, electric shock sensation, nausea, flu-like symptoms. These are discontinuation symptoms, and this medication need to be taper and stop slower. Venlafaxine, when you think about venlafaxine, think about blood pressure and discontinuation symptoms, discontinuation syndrome. 50 medications that you want to memorize before you take the board include Cymbalta. Cymbalta or duloxetine. Duloxetine or Cymbalta. Duloxetine is serotonin and norepinephrine reuptake inhibitor class. Duloxetine inhibits serotonin and norepinephrine reuptake that increases both this serotonin and norepinephrine in the nervous system. Duloxetine is indicated for major depression disorder. Duloxetine is also indicated general anxiety disorder. Duloxetine is also indicated for diabetic peripheral neuropathy. Also, it's indicated for chronic muscle skeletal pain. It also indicated for fibromyalgia. Starting dose for duloxetine is 30 to 60 milligram per day. However, the therapeutic dosage is 60 milligram per day, and 60 milligram is commonly used. The major adverse effects of duloxetine, Cymbalta, other name Cymbalta, it is nausea. It causes nausea, it causes dry mouth, it causes constipation, it causes diaphoresis, it causes sexual dysfunction, it causes potential liver toxicity, it increases blood pressure, and it causes discontinuation syndrome. So you want to monitor the blood pressure, you want to monitor the mood, patient mood, you want to monitor liver enzyme, you want to also monitor adverse effects and signs of discontinuation symptoms. Duloxetine, Cymbalta can interact with MAO inhibitor medication. Cymbalta can interact with other medication that also increases the serotonin, and that can lead to serotonin syndrome. It interacts with the drugs that affecting the enzymes such as CYP1A2 or CYP2D6. It interact with these medications and it can increase their side effects. You want to educate the patient to report dark urine, jaundice, severe abdominal symptoms. You want to also educate the patient, do not stop quickly this patient. Duloxetine is indicated for depression, anxiety, and neuropathic pain or chronic pain. The 6 medication that you want to memorize before you take the board is Bupropion or Valproate. Bupropion or Valproate is the class is norepinephrine dopamine reuptake inhibitor. So it inhibit the norepinephrine and dopamine reuptake that increases both this norepinephrine and dopamine in the central nervous system. Mechanism of the bupropion, it inhibits both norepinephrine and dopamine reuptake. It indicated for major depression disorder. It also indicated for seasonal affective disorder and smoking cessation. Common dosage, starting dose, common indicator relate to the sustaining release. Enrichment begins with 150 milligram per day, depending on the formation. However, the therapeutic dose of Valproate, it is usually 300 milligram a day for many adults and depending on the formation. Major side effects and major adverse effects include insomnia, anxiety, agitation, tremors, headache. It increases the blood pressure and it increases the seizure threshold and can cause seizure. You want to monitor, also it increases the weight, so you want to monitor the blood pressure, you want to monitor the weight, you want to monitor the mood, anxiety, and seizure risks. Bupropion contraindication is the patient who has a seizure disorder, patient who has bulimia nervosa or anorexia nervosa. You want to also educate the patient with not stopping the medication quicker. This medication is also indicated with the patient who is taking benzodiazepine and who is also withdrawal of alcohol, and concerning is anti-anxiety medication and containing so it is contraindicated with abrupt withdrawal from alcohol or benzodiazepine, barbital, or certain anti-seizure medications. It's contraindicated if the patient takes these medications, if they have anorexia nervosa or bulimia nervosa or seizure disorders. Important interaction with this medication include MAOIs medications and the medications that substrains enzyme CYP2D6 and other medications that lowers the seizure threshold. You want to educate the patient to take earlier in the day because it causes insomnia if you take close to the nighttime. You want to educate the patient to take this medication as prescribed and do not exceed the prescribed dosage. You want to educate the patient to report seizure activity and severe agitation. Bupropion has a fewer sexual side effects and has a has seizure risks. 7 psychiatric medication that you want to memorize include Remeron. Remeron is noradrenergic and specific serotonin antidepressant medication. Mechanism of Remeron, it is antagonist central alpha 2 anergic receptor and several serotonin receptors. It's strongly histamine blocker in the H1 receptor. It indicated Remeron, it indicated for major depression disorder and other, particularly useful when the depression occurs with insomnia, poor appetite, weight loss. Starting dose is 15 milligram at night. However, the therapeutic dosage of Remeron is 15 milligram to 45 milligram at night. Major adversary effect of Remeron is sedation. It increases the appetite. It increases the weight gain. It causes dry mouth. It causes constipation. So you want to monitor the weight, the appetite, the mood, and the sedation. It is contraindicated for MOA inhibitor medications, and you want to be cautious with the patient who have liver impairment or kidney impairment. Important interaction with Remeron include MAO inhibitor, alcohol, other sedative medications. You want to educate the patient to take this medication at their time and be aware of that this medication can increase the appetite, can increase the weight, and can increase the sedation. This medication is prescribed and indicated for depression, with insomnia, with poor appetite, with people who have a low weight or losing weight. The 8 medication that you want to memorize, psychiatric medication that you want to memorize, is a lithium. Lithium is mood stabilizer. Lithium class is mood stabilizer. Lithium mechanism is a complex intracellular signaling. It has an intracellular signaling that affects and involves multiple second messenger systems. Lithium is indicated for bipolar 1 mania. It indicated for acute mania and bipolar maintenance. It's also added in the treatment-resistant depression in a selective patients. Starting dose for lithium is commonly 300 milligram 2 times or 3 times a day in divided doses, depending on the formula and clinical indication. Lithium therapeutic level. Lithium has a short therapeutic level. For acute mania, approximately therapeutic level is 0.8 to 1.2. Maintenance dosage approximately is 0.6 to 1. Targets should be individualized. So the therapeutic target should be individualized. Major adverse effects of lithium include tremors, nausea, diarrhea, polydipsia, low thyroid, hyperparathyroid or hyperglycemia, kidney side effects, weight gain, and lithium toxicity. You want to monitor when the patient is taking lithium. You want to monitor before and during the therapeutic, during the treatment. Before and during the treatment, you want to assess the lithium level, lithium concentration. You want to also assess the kidney function, thyroid function, thyroid level. So you want to check, you want to take the lab and check the kidney function. You want to thyroid function. You want to check the calcium level, electrolytes, weight gain. You want to test the patient if they are pregnant. You want to check the pregnancy status when it's appropriate. Contraindication for lithium include a significant kidney disease. If the patient have a significant kidney disease, if the patient have significant sodium depletion, if the patient have a severe dehydration. Important interaction with lithium include, and that increases the level of the lithium, include thiazide diuretics. Thiazide diuretics will increase the lithium level. NSAID medication will increase the lithium level. Angioconverting enzyme inhibitor medication, which is blood pressure, can increase the lithium level. ARP angiotensin receptor blockers can increase the lithium level. So that is also blood pressure medication. You want to educate the patient to maintain a consistent fluid and sodium intake. Consistent, it's not high or low, consistent fluid and sodium level, because both can affect the lithium level. You want to educate the patient to seek medical advice if they are having a severe vomiting, severe diarrhea, if they dehydrated, major changes in their fluid intake. Lithium, you want to assist the kidney function, thyroid function, calcium function, and lithium level. Other 9 medication that you want to assess, psychiatric medication, ninth psychiatric medication that you must memorize include Valproate. Valproate, it is mood stabilizer and anti-seizure medication. Indication of this medication include acute mania, bipolar disorder, seizure disorder, migraine prevention. Dosage is starting dose of Valproate. It is 75 milligram a day in divided doses for mania depending on the formula and patient factor. Therapeutic dosage is approximately 50 milligram to 125 milligram for many psychiatric indications. Major adverse effect of this medication is weight gain, sedation, tremors, nausea, thrombocytopenia, liver toxicity, pancreatic inflammation, hyperammonemia, hair loss. So you want to monitor the liver function, complete blood count and platelet assessment. You want to also assess the blood level concentration when indicated, weight gain, pregnancy status. You want to assess pregnancy status before you start the medication and during the treatment. Ammonia level, you want to assess the ammonia level. Contraindication of this medication include a significant liver disease, pregnancy particularly because of the major viral risk, and certain monoclonal disorders. This medication interacts with Lamotrigine, it interacts with carbamazepine, it interacted with aspirin and other central nervous system depression medication. You want to educate the patient to report severe abdominal pain, persistent vomiting, jaundice, sign of jaundice, unusual bruises, severe lethargic or confusion. Valproate is indicated for mania. You want to assess the liver function, platelet, and pregnancy status. The 10 psychiatric medication that you want to assess is Lamotrigine. So second part will begin in the Lamotrigine.